Komfo Teaching Hospital, the biggest referral hospital in the northern half of the country, have introduced some tough measures there. They've actually announced it today. What we're learning is that all outpatient department services have been banned. Ohimi Interior is there for us and he joins us live. Hello, Ohimi.
Good evening.
Do tell us how the Komfo Teaching Hospital authorities came by this decision to suspend these services, and how is it playing out when you get to the hospital? What do you see?
Komfo Teaching Hospital, in a press release signed by the Chief Executive Officer, Dr. Ohineba Owusu-Danso, announced the suspension of what caregivers described as vital services to patients who patronize the services of the Komfo Teaching Hospital. For instance, the release says all elective surgeries, excluding cesarean sessions, have been suspended, and all outpatient department services, including clinical meetings and seminars, as well as rotations and attachments by all categories of students to the hospital have been suspended. So this morning we hit the hospital to get some answers from hospital management to see how they will be reacting or be explaining the circumstances leading to the suspension of services at the hospital. But Gifty, I must say the release says this is as part of efforts to forestall what they describe as spread of coronavirus in any event of a coronavirus outbreak at the facility. So this morning when we reached the hospital here, a lot of in and returning at the same time. The reason being that when they come and they are hit with the announcement that the hospital has suspended OPD cases, they have no option than to go home. There were instances where some patients had to hang around the hospital premises to see if they will have the opportunity to speak to some doctors or nurses on what can be done about their situation. Now, let me explain this further. When you talk of OPD cases at the Komfo Teaching Hospital or services, there are two types of services: the specialist OPD and then primary care OPD. For the specialist OPD, it comprises more than 40 specialized clinics for people suffering from all kinds of ailments that needs a specialist attention. And then with primary care OPD, these are people who walk into the facility even not on refer basis and then seek care from the Komfo Teaching Hospital. So this has come as a very hard news to the patients who patronize the services of the hospital. For instance, between 2019, when you look at the trend, one can realize that the hospital sees not less than between 1,000 and OPD cases here at the Komfo Teaching Hospital, including specialists cases here at the Komfo Teaching Hospital. So what it means is that patients who come in have no option but to rely on probably other peripheral facilities around the Komfo Teaching Hospital, or maybe access care from private health facilities. And when we spoke to some of them, they had come from Central Region, Western Region, some from the Upper East and Upper West regions who probably didn't hear this announcement that the hospital has suspended these services that were initially at their disposal. So the hospital management, when I spoke to a close source who want to remain anonymous, told me that these are measures that they want to institute to prevent any spread of the coronavirus. Because they say, for instance, if there is to be an outbreak at the Komfo Teaching Hospital, it will not only affect the over 1,400 patients that I mentioned, but they also affect relatives and family members of the patients, because normally the patients come to the hospital with the support of their relatives, sometimes 2 or 3 relatives who come around to support them at the facility.
Right.
And so they believe that if this is allowed to go, and in the event of any outbreak of coronavirus, it will go a long way to affect the Komfo-Anokye Teaching Hospital and patients who access care here. As we speak now, management are locked up in the told, but top of the agenda will be a discussion on the coronavirus issue.
Well, I mean, we will be subsequently, we'll be getting to see the impact that this decision is having on other health facilities within the region. As you said, this hospital is key to over 1,000 people on a daily basis.